I'm Professor Sims, and in this video I will discuss the muscular system. This is the 9th in a series of 10 lessons held as part of my Anatomy and Physiology 1 course. If you're a student currently enrolled in this course, please consult the syllabus and course Moodle site for assignments, quizzes, due dates, and other course information. In this unit, we will learn about the actions and roles of agonists and antagonists, the structure and organization of muscle fascicles and their role in generating force, the criteria used to name skeletal muscles, and their actions on the skeleton and soft tissues of the body, and finally, we will identify the origin and insertions of skeletal muscles and their prime movements. Skeletal muscles typically attach to bones at 2 points. The origin is the fixed or stabilized attachment, usually proximal, and the insertion point is the point on the bone that moves during contraction. Muscles function in groups to produce efficient and controlled movement. The prime mover is called the agonist, and this is the main muscle responsible for a specific motion. The antagonist performs the opposite action, and this helps to regulate the movement. Synergists assist the prime mover by adding force or minimalizing unwanted motion. And fixators, which are a type of synergist, they stabilize the origin of the prime mover to enhance precision. Although all skeletal muscle fibers contract similarly, performance varies depending on how muscle fascicles are arranged and how tendons attach to the skeleton. Fascicle arrangements include circular, convergent, parallel, and pinnate. There's 3 types of pinnate forms: unipinnate, bipinnate, and multipinnate, and these are all suited for specific mechanical roles.
So if you're looking at this anatomical model, you can very clearly see the fiber orientations. This is a very effective teaching tool. So what we're going to be looking at are 2 muscles, and these are going to be examples of circular muscles or circular fiber orientations. So the first is going to be this one, which is surrounding the eye. This is called the orbicularis oculi. It's super cool if you just kind of look at those fibers as it's surrounding the eye and going onto the eyelid. And then the next is going to be the orbicularis oris, which is going around the lips. Now, both of these muscles are essentially sphincters, and their job is to protect, the eyes, the mouth from, anything going inside of them, right? You're essentially stopping something from going from an external surface into an internal surface. Now, the eye isn't directly an internal surface. I mean, I guess it kind of is, but not as internal as, say, the oral cavity of the mouth. But you still want to protect those delicate tissues. So in the event that, say, like sunlight or rain or you name it, trying to get into the eye, this can very quickly cinch shut, right? And again, you can look at those fibers and just very clearly see how this would just quickly tighten and slam the eye shut. And the same goes for that mouth, right? So you can see orbicularis oris here. You can just picture that would just tighten up, cinch it down, and then nothing's getting inside of that oral cavity. Next up, we have parallel fiber orientations. And as the name suggests, all this means is that the fascicles, those fibers, are running in parallel to one another and within the longitudinal axis of that muscle itself. Now, I've always taught there being 2 primary examples of these parallel oriented muscles, but depending on the text, you may see others being included in this. But the first is what we call a strap muscle. And again, to no one's surprise, that's because it looks like a strap. You can think like a towing strap. The classic example is the sartorius muscle. It's the longest skeletal muscle in the body. It runs from the anterior side of the hip all the way down to the medial or inside of your knee. And it's going to produce a lot of range of motion. It's going to swing your hip. It's going to swing your knee. It is a very mobile muscle. It's a very long muscle. And that's because, for that entire length of the muscle, that's how long those proteins are, the fascicles, the contractile components of the muscle. It's a really, really long muscle. Then you have what's called a fusiform muscle shape. Now, the classic example here is going to be biceps brachii. So a fusiform, you can think of it like a spindle shape. So on either end of the muscle, where those tendons are, you're going to have more narrow tendons, right? The muscle's actually going to take more narrow appearance, but in the center, where that muscle belly is, it's going to be more bulbous. And so what this allows you to do is have a significant amount of muscle mass that is then able to insert in a really small, tight area. And that's exactly what biceps brachii does. By especially going into its radial attachment, it's just pushing through this really tight area, hitting that radial tuberosity, It's just a really cool shape. Next, you have the oblique fiber orientation muscles. And so again, to no one's surprise, that's because the fascicles or fibers are going at an angle, at least in relation to the longitudinal axis of that muscle. Now, the first type is what's known as a convergent muscle type. So easy example here is going to be the pectoralis major. And this is such a cool muscle to look at because when you see it, you can see this really wide attachment on the sternum going to the clavicle. Then all those fibers are just fanning and converging together and then attaching at the humerus at the intertubercular groove. It's just a really cool muscle to look at. It's probably my favorite muscle to look at. Then we have the pennated muscles. So pennate means feather or feather-like. And so the first one is called a unipennate. So in this type of muscle, you have a central tendon, and then you have a bunch of fascicles that are on one side of that tendon, all coming at an angle. And what will happen is when they end, those fascicles that is, their connective tissues turn into an aponeurosis, which is an aponeurosis is a sheet-like tendon, which will then attach to that more cord-like central tendon. So then what you have is all these tiny little contractions occurring. So the easy example here is extensor digitorum. When you see extensor digitorum, which is in the forearm, it's in the extensor side of your forearm or anabrachium, it's just you have all these fibers just coming at one angle, attaching that central tendon. So what will happen is they pull, it pulls on that central tendon, and you generate movement. The next example is called a bipennate. This is the exact same thing as a unipennate, except with a unipennate, all the fibers were on one side. Bipennate, it's mirrored. So now you have fibers on either side of that central tendon. The easy example here is the rectus femoris. It's a quadriceps muscle, so it's going to be in the anterior side of your hip. And as you can see, there's just this central tendon running down the center, and then you have two sides, on either side of it, you have the oblique angle. So again, now what you've done is you've just doubled the amount of protein that you can fit in that space. Then the third type is what's called a multipennate. This one is really, really cool because what you have is just fibers just going and fascicles just going in every direction you can pretty much imagine, all pulling on their own little tendons, which are all going to start converging into one larger tendon. So the easy example here is the deltoid muscle. Deltoid has to do a lot. It has to do flexion of the shoulder, abduction of the shoulder, extension of the shoulder. It's rotating. Deltoid has to do a lot of functions, but the thing to understand is it also has to overcome gravity to do it. It's kind of hard to just lift your shoulder in the way that's needed. So deltoid is obscenely strong because you can fit in a ton of protein by shoving it and going in all these different directions, all pulling on these little tendons, which are converging onto one tendon, which will eventually produce one massive movement. Such a cool muscle.
Circular muscles, also known as sphincters, are arranged in concentric bundles that control the size of an opening. When these muscles are relaxed, the bundles allow the opening to widen, and when they contract, the bundles tighten and reduce the size of the opening until it closes completely. In contrast, convergent muscles have a broad area of origin and taper as their fascicles converge toward a single common attachment point. An example of convergent muscle is shown here in figure 11.3. This is the pectoralis major, which extends across a wide region of the chest, but then converges on to the greater tubercle of the humerus. Pinnate muscles have fascicles that run through a central region along the length of the muscle. In unipennate muscles, the fascicles are arranged only on one side of the tendon, whereas bipennate muscles have fascicles located on both sides of a tendon. And this creates a symmetrical structure. In multipennate muscles, the muscle fibers branch out and wrap around the tendon from multiple directions, allowing for greater force production. So this here is showing the unipennate fascicles of the digitorum, the multipennate fascicles of the deltoid, and then the bipennate fascicles of the rectus femoris here in the leg. Parallel muscles are characterized by fascicles that run parallel to the long axis of the muscle, and they make up the majority of skeletal muscles in the body. Some parallel muscles are non-fusiform, meaning they do not have a large central belly, and then fusiform parallel muscles feature a prominent central belly that tapers at both ends as it extends towards its origin and insertion points. So this here is the sartorius muscle, and this is a parallel muscle, but it is not fusiform. fusiform. And then, of course, you have the biceps, classic example of fusiform parallel skeletal muscle. Muscle mechanics operate on the principles of levers, or levers, which include a rigid bar, such as a bone, that moves around a fixed point called the fulcrum, typically a joint, and the effort required to move the lever is generated by muscle contraction, while the load represents the resistance that might be overcome. There's 3 types of levers found in the body. In a first-class lever, the fulcrum is positioned between the effort and the load. A second-class lever places the load between the effort and the fulcrum. And then the most common type in the human body is the third-class lever, where the effort is applied between the load and the fulcrum. Here's a clip that will help to simplify this concept some more.
In the human body, we have 3 classes of levers, and they're named based on the arrangement of their different components. These components include a rigid body, which is basically just a bone that's being moved, a fulcrum, which is the fixed point the bone is rotating around. This is usually, but not always, a joint, so just be careful not to assume it's a joint, or that's when they'll trick you and you'll lose points. The effort is where your muscle attaches to the bone being moved. It's your muscle, it's your effort, it's you trying to move the bone against the resistance. The resistance can be anything that you're trying to move. It can be your whole body weight. It could be the weight of a limb. It could be a dumbbell that you're trying to move or a box you're trying to pick up. It's anything you're trying to move with this lever system. Now, to remember the location and the classifications of these levers, we use the mnemonic FRE. These letters tell you which component is located in the middle of each lever. The F, since it's in the first position, refers to class 1 levers and tells us that the fulcrum is located in the middle. With the fulcrum in the middle, we know that the other components must go to the side, so we'll put the resistance here and the effort here. An example of a class 1 lever is the triceps brachii muscle interacting with the elbow joint. So as you can see, the triceps inserts at the olecranon process, which is very slightly behind the elbow joint, which is acting as a fulcrum. The forearm, of course, would then act as resistance as what you're trying to move in this lever. The R in FRE, since it's in the second position, refers to second class levers and tells us that the resistance is in the middle with the other components on the side. The classic second-class lever in the body is seen during a heel raise. The effort is the gastrocnemius soleus muscle pulling at the calcaneus, the resistance is our body weight, and the fulcrum is the ball of our foot. An important thing to remember about second-class levers is that they have a natural mechanical advantage, which partially explains why we can perform a single-legged heel raise with a relatively small muscle. The E in FRE is in the third position, referring to third-class levers, and this tells us the effort is in the middle of this lever. The important thing to remember here is that most levers of the body are class 3 levers, and they have a mechanical disadvantage, which means most of our muscles have to work extra hard to lift against resistance. An example of a class 3 lever in the human body would be the biceps brachii interacting with the forearm. The fulcrum here would be the elbow joint. The biceps brachii inserting at the radius would be the effort, and then the weight in the hand would be the resistance.
Muscles are named according to several key criteria that describe their characteristics and functions. One of these is location, which refers to where the muscle is found in the body, such as the tibialis anterior or the gluteus maximus, right? Size is another factor with terms like major, minor, maximus, and minimus, and this indicates the relative size of the muscle. The shape of a muscle can also influence its name. For example, the deltoid is named for its triangular shape, and the trapezius is named for its trapezoid shape. The direction of the muscle fibers provide additional information with terms like rectus, meaning straight, and oblique, referring to diagonal fibers. Muscles may also be named based on the number of origins that they have. This is seen in the biceps, for example, which have 2 origins, and the triceps, which have 3. Some muscle names reflect the bones to which they attach, such as the sternocleidomastoid, which connects the sternum, clavicle, and mastoid processes. Finally, many muscles are named according to their function or action, with names like flexor, extensor, and abductor, describing the type of movement that they produce. Here are more examples of muscle names and their meanings. The abductor digital minimi, this is a muscle that moves the little finger or toe away from the body's midline. The pectoralis major is the large muscle of the chest. The biceps brachii refers to an arm muscle with 2 points of origin, and the extensor carpi radialis is a muscle that extends the wrist and lies near the radius bone of the forearm. So here you can see how understanding the etymology and correct pronunciation of these terms can greatly improve your vocabulary retention. That is, learning the roots of the anatomical words is going to help you to remember them. And it takes practice, but recognizing these origin makes it a lot easier to remember both the names and the function of the muscles. Here's a table that breaks down how skeletal muscles are named using the root terms, their Latin or Greek translation, and mnemonic devices that can help you to remember them. Knowing these roots helps in memorizing the names, what they do, where they're located. For example, common regional terms include the brachii, which is the arm, femoris is the thigh, carpi is wrist, abdominis is the abdomen. Then you have directional terms such as anterior, posterior, medialis, lateralis, position terms that we learned all the way back in lesson 1. Structural terms like longus, brevis, maximus, minimus. These help to denote length and size. And then action terms like levator, depressor, rotator, and tensor reveal function. Some muscles even carry historical or descriptive names like buccinator, meaning trumpeter, or sartorius, which is to tailors. It's a tailor's crossed leg position. Some old-timey terms. Please watch this clip about how the naming criteria of skeletal muscles work, and we'll go into some more detail about the muscles, locations, and names.
Starting with the first criteria, direction of muscle fibers. For example, the orbicularis oculi muscle is named based on that criteria. The fibers run in a circle. Also, the orbicularis oris muscle, the fibers run in a circle. Another example is the rectus abdominis muscle, where the fibers, they run parallel to the midline of the body. The external oblique muscle, the fibers run with the angle to the midline of the body. Moving to the second criteria, which is shape of the muscle. For example, the trapezius muscle is trapezoid in shape. The deltoid muscle looks like the Greek letter delta. The rhomboid muscles, this is the rhomboid minor, the rhomboid major muscle, they look like a rhombus in shape. Moving to the third criteria, which is location of the muscle. For example, the supraspinatus muscle is on the supraspinous fossa of the scapula. The infraspinatus muscle is on the infraspinous fossa of the scapula. The frontalis muscle is on the frontal bone. The occipitalis muscle is on the occipital bone. The temporalis muscle is on the temporal bone. Moving to the fourth criteria, which is action of the muscle. The pronator teres muscle pronates the forearm. The pronator quadratus muscle pronates the forearm as well. The extensor digitorum muscle extends the fingers. The extensor digitorum longus muscle extends the toes. The flexor carpi radialis muscle flexes the wrist. The supinator muscle supinates the forearm. Moving to the fifth criteria, which is number of origins. For example, this is the biceps brachii muscle. Bi means two, ceps, two heads, two origins. We have the medial, which is the short head, and this is the long head. Another example is the triceps brachii muscle, which has three heads. This is the lateral head, this is the long head, and right here we have the medial head. Another example is the quadriceps femoris muscle. Quadri means four, ceps heads. This is the vastus medialis, that is the rectus femoris, that is the vastus lateralis, and this is the fourth origin, which is the vastus intermedius muscle. Moving to the sixth criteria, which is relative size of the muscle. For example, this is the gluteus maximus. Maximus means the largest. This is the gluteus minimus. Minimus means the smallest. Another example is the fibularis longus. Longus means long. Fibularis brevis. Brevis means short. Moving to the seventh criteria, which is location of muscles, origin and insertion. Don't confuse this criteria with the location of the muscle criteria. An example of the seventh criteria, which is location of muscles, origin and insertion, we have the sternocleidomastoid muscle. This muscle, it has two origins. This muscle origin is on the sternum, sterno, and the clavicle, clavido. And it is inserted on the mastoid process of the temporal bone. Another example is the sternohyoid muscle, which runs between the sternum, that's one location, and the hyoid, that's the other location. There are muscles, for example, like the adductor longus. Right underneath it, we have the adductor brevis, adductor magnus. These three muscles are named based on two criteria: adductor, which is the adduction action of the muscle, and magnus, meaning large, brevis, short, longest, long, and relative size of the muscle. Whereas, for example, the pectoralis major muscle and the pectoralis minor muscle, these two muscles are named based on two criteria, which is the relative size, pectoralis major versus minor, and the location of the muscle, pectoralis, meaning this muscle is located on the pectoral region, which is the chest region. And according to that, the remaining skeletal muscles are named based on one or more of the 7 criteria for naming skeletal muscles.
So similar to how we talked about the axial and appendicular bones, that's how we will move on in our discussion about skeletal muscles. Axial muscles provide essential core support and help maintain the body's position and posture. These muscles are typically grouped based on their location, function, or a combination of both, and they include the muscles of the head and trunk. Appendicular muscles are responsible for supporting, moving, and stabilizing the upper limbs and the other appendages of the body. So axial and then appendicular is going to be the rest. All muscles of the head and neck are classified as axial muscles. The muscles responsible for facial expression, such as the frontalis, orbicularis oculi, orbicularis oris, risorius, zygomaticus major and minor, buccinator, and levator palpebrae superioris. The frontalis raises the eyebrows and wrinkles the forehead. The orbicularis oculi closes the eyelids. The orbicularis oris puckers and closes the lips. The risorius pulls the corners of the mouth outward, producing a smile. The zygomaticus major and minor elevate the corners of the mouth, helping to create a smile or a laugh. The buccinator compresses the cheeks, aiding in chewing and blowing. And the levator palpebrae superioris raises the upper eyelid, which opens the eye. The extrinsic eye muscles originate outside the eye and insert directly onto its surface. Figure 11.9 shows the location of key muscles in this group, including the superior, inferior, medial, and lateral rectus, as well as the superior and inferior oblique muscles. The superior rectus elevates the eye, moving it upward. The inferior rectus depresses the eye, moving it downward. The medial rectus moves the eye inward toward the nose, whereas the lateral rectus moves the eye outward away from the nose. The superior oblique rotates the eye downward and outward, also known as intorsion and depression, and the inferior oblique rotates the eye upward and outward, also known as extorsion and elevation. The tongue has both intrinsic and extrinsic muscles. Among the extrinsic group, the genioglossus moves the tongue down and forward, the styloglossus moves it up and back, and the paladoglossus elevates its posterior portion, while the hyoglossus flattens and depresses the tongue. Muscles of the anterior neck are used for swallowing, speech, and stabilizing the hyoid bone and larynx. These include the digastric, stylohyoid, mylohyoid, geniohyoid, amohyoid, sternohyoid, thyrohyoid, and sternothyroid. The digastric muscle helps open the mouth by lowering the mandible and elevates the hyoid bone during swallowing. The stylohyoid elevates and retracts the hyoid bone, assisting in swallowing. The mylohyoid forms the floor of the mouth and elevates the hyoid bone and tongue during swallowing and speaking. The geniohyoid pulls the hyoid bone forward and upward, aiding in swallowing. The amohyoid depresses and stabilizes the hyoid bone. The sternohyoid lowers the hyoid bone after it has been elevated during swallowing. The thyrohyoid elevates the thyroid cartilage and depresses the hyoid bone. And then finally, the sternothyroid depresses the thyroid cartilage, helping to lower the larynx. The last one on this list is the sternocleidomastoid, which divides the neck into anterior and posterior triangles and facilitates head rotation and flexion. Figure 11.10 illustrates the muscle of the jaw, highlighting the masseter and temporalis muscles. which work together to elevate the mandible and close the jaws. So these muscles are responsible for moving the lower jaw and are primarily located within the cheeks and originate from various bony processes of the skull. Their strategic placement and attachment points give them significant leverage and allow for powerful and efficient chewing motions necessary for breaking down food. Figure 11.14 shows the key superficial and deep muscles of the neck. These muscles facilitate a wide range of motions, including turning and tilting the head, flexing and extending the cervical vertebrae, and stabilizing or moving the scapulae. Together, they support head posture, enable complex neck motions, and assist with shoulder movements essential for upper body function. The deep muscles of the neck and back stabilize and move the vertebral column. These complex overlapping muscles are organized into 5 main groups. The splenius group includes the splenius capitis and splenius cervicus muscles. The erector spinae group is divided into 3 subgroups: iliocostalis, which is cervicus, thoracis, and lumborum; longissimus, which is the capitis, cervicus, and thoracis; and then spinalis also has capitis, cervicus, and thoracis. The transversospinalis group comprises the semispinalis, multivitus, and rotatorus muscles. The segmental muscles include interspinalis and intertransversari, which connect adjacent vertebrae. Finally, the scalene muscles, the anterior, middle, and posterior scalene muscles, assist with head movement and play a role in deep inhalation. The anterior abdominal wall, composed of skin, fascia, and 4 pairs of muscles, serves to protect abdominal organs and assist in movement of the vertebral column. These muscles include the rectus abdominis, which runs the length of the trunk and aids in flexion, such as when you're sitting up. The external and internal obliques facilitate twisting and side bending, and the transversus abdominis compresses the abdomen during forceful exhalation, urination, defecation, and childbirth. The linea alba is a fibrous band where these muscles converge at the midline. The quadratus lumborum is located in the posterior abdominal wall and also contributes to trunk movement and stabilization. The muscles of the thorax are used for respiration. The diaphragm is a dome-shaped muscle that flattens during contraction and increases thoracic volume while decreasing internal pressure to draw air into the lungs. The external intercostals elevate and expand the rib cage during inhalation, while the internal intercostals assist with forced exhalation by pulling the ribs downward and inward. The pelvic floor and perineum muscles are distinct regions with complementary functions. The pelvic floor is a deep muscular layer at the base of the pelvic cavity and includes the levator pubococcygeus, puborectalis, and iliococcygeus, which grouped together makes up the coccygeus. These muscles support pelvic organs, maintain continence, and resist intra-abdominal pressure. They also help in urination, defecation, and childbirth, and sexual activity. The perineum is a more superficial area below the pelvic floor, extends from the pubic symphysis to the coccyx, and is divided into urogenital and anal triangles. It contains muscles such as the bulbospongiosus, ischio-cavernous, transverse perineal muscle, and external anal sphincter. These assist in genital movement, sphincter control, and reproductive function. Together, both muscle groups support core stability and help regulate urinary, digestive, and sexual systems. Several muscles are responsible for stabilizing and positioning the pectoral girdle, and they are located on the thoracic region of the body. On the anterior side, these include the subclavius, which lies just beneath the clavicle, the pectoralis minor, a thin triangular muscle located beneath the pectoralis major, and the serratus anterior, which appears as a series of finger-like projections along the ribs. On the posterior side, key muscles include the trapezius, which is a large superficial muscle that extends from the neck and shoulders down the back, the levator scapulae, which elevates the scapula and runs from the cervical vertebrae to the upper scapula, and the rhomboid major and rhomboid minor, which are deeper than the trapezius and they connect the scapula to the spine. There are 9 muscles that cross the shoulder joint, and they move the humerus and actions like abduction, adduction, rotation, flexion, extension. 2 originate on the axial skeleton, the pectoralis major, and latissimus dorsi, which is a wide back muscle. The remaining 7 originate on the scapula. The deltoid covers the shoulder and abducts the arm. The subscapularis lies on the front of the scapula. The supraspinatus and infraspinatus sit above and below the scapular spine. The teres major and teres minor run along the lateral scapula, and the coracobrachialis connects the coracoid process to the humerus. To identify these muscles, locate bony landmarks like the scapula, clavicle, and humerus first, and then the deltoid forms a cap over the shoulder, while the supraspinatus and infraspinatus lie above and below the scapula. And then the teres muscles are along the lateral scapula, with the major being larger and lower. The pectoralis major is easily found on the chest, and then the latissimus dorsi sweeps from the lower back. The scapularis is best seen anteriorly, and the coracobrachialis appears near the medial arm. Forearm movement involves muscles responsible for flexion, extension, pronation, and supination. Biceps brachialis and brachioradialis flex the elbow. Triceps brachii and anconeus extended. Pronator teres and pronator quadratus turn the palm down, which is pronation, and supinator rotates it upwards, which is supination. To locate these, look for the biceps brachii on the front upper arm and brachialis deep into the arm. The brachioradialis runs along the lateral forearm, and then posteriorly the triceps brachii dominates the upper arm with the anconeus near the elbow. Pronator teres crosses the proximal forearm. Pronator quadratus sits near the wrist and is deeper. The supinator wraps around the upper radius. And again, these are examples where you can use the muscle location, orientation, and landmarks like the humerus, radius, and ulna to guide and help remember how to identify all of these. The extrinsic muscles of the hand originate in the forearm and insert into the hand to enable gross motor functions. The superficial anterior forearm muscles, including the flexor carpi radialis, palmaris longus, flexor carpi ulnarius, and flexor digitorum superficialis, produce wrist and finger flexion. The deeper flexors, such as flexor pollicis longus and flexor digitorum profundus, contribute to figure movement as well. On the posterior side, muscles like the extensor carpi radialis longus and brevis, extensor digitorum, extensor digi minimi, and extensor carpi ulnaris extend the wrist and fingers. Deep posterior muscles such as the abductor pollicis longus, extender pollicis brevis and longus, and extensor indicus assist with thumb and finger extension. Precision finger movements are controlled by intrinsic hand muscles, which both originate and insert within the hand. The thenar group, including the abductor pollicis brevis, opponus pusillus, flexor pusillus brevis, and adductor pusillus, controls thumb motion. The hypothenar group, made up of the abductor digiti minimi, flexor digiti minimi brevis, and opponus digiti minimi, controls the 5th digit. The intermediate group consists of the lumbricals and the palmar and dorsal interossae, which allow fine motor control, such as finger abduction, adduction, and coordinated flexion at the knuckles. The iliacus and psoas major muscles, collectively called the iliopsoas, are primary hip flexors that lift the thigh towards the torso. The large gluteus maximus, gluteus medius, and gluteus minimus muscles are located on the posterior hip and are responsible for extending and abducting the femur. The gluteus maximus also helps form the iliotibial tract along with the tensor fasciae latae, which abducts and medially rotates the thigh while stabilizing the trunk. On the medial side of the thigh, the adductor longus, adductor brevis, and adductor magnus work together to adduct and medially rotate the thigh, bringing the leg toward the midline. The pectineus muscle assists by adducting, flexing, and medially rotating the femur. The iliopsoas is best seen in deep anterior views, spanning from the lumbar vertebrae and iliac fossae to the lesser trochanter of the femur. The gluteus muscles are positioned on the posterior hip. The maximus is the largest and most superficial. The medius lies just beneath it, and the minimus is deepest and smallest. The tensor fasciae latae is found on the lateral thigh near the hip. On the medial thigh, look for the 3 adductors arranged from superficial to deep and pectinus near the upper thigh. The muscles of the thigh that move the femur, tibia, and fibula are categorized into 3 compartments: medial, anterior, and posterior. The medial compartment includes the adductors pectineus and gracilis. The anterior compartment consists of the quadriceps femoris, which includes the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius, as well as the sartorius muscle. The quadriceps extend the knee, while the sartorius also flexes and laterally rotates the femur. The posterior compartment contains the hamstrings, bicep femoris, semitendinosus, and semimembranosus, which flex the knee and extend the thigh. Muscles in the leg that move the foot and toes are divided into anterior, lateral, superficial posterior, and deep posterior compartment. The anterior compartment includes the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius. The lateral compartment contains the fibularis longus, fibularis brevis, both responsible for feet eversion. And in the superficial posterior compartment, the gastrocnemius, soleus, and plantaris contribute to plantar flexion of the foot. The deep posterior compartment includes the popliteus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus, which perform various functions, including inversion and flexion of the foot and toes. The anterior compartment muscles are found on the front of the leg. The tibialis anterior runs along the lateral side of the tibia, just next to the shin. The extensor hallucis longus and extensor digitorum longus lie centrally and laterally extending towards the toes, while the small fibularis tertius is near the ankle on the lateral side. The lateral compartment muscles, fibularis longus and fibularis brevis, run down the outer side of the leg behind the fibula and help evert the foot. These muscles are visible along the leg's outer edge. In the superficial posterior compartment, the large prominent gastrocnemius forms the calf's bulk and attaches to the heel via the Achilles tendon. Beneath it lies the soleus, which is a flatter, broader muscle. The small plantaris is located between these two and can be seen towards the knee, closer toward the knee in some views. The deep posterior compartment muscles are located deeper in the back of the leg. The popliteus is a small muscle just behind the knee. The tibialis posterior, flexor digitorum longus, and flexor hallucis longus run alongside the tibia and fibula towards the foot, and these help with inversion and toe flexion. Figure 1134 gives a more detailed view of the muscles that are involved in foot movements and toe flexion. Muscles along the dorsal side are generally involved in extending the toes, while muscles on the plantar side of the foot generally flex the toes. The plantar muscles exist in 4 layers, which provides the foot the strength to counterbalance the weight of the body. This diagram shows 3 of those layers from the plantar view, beginning with the bottommost layer just under the plantar skin of the foot, and ending with the topmost layer located just inferior to the foot and the toe bones. Here's a short video that summarizes some, but not nearly all, of the muscles that we have discussed today.
The pectoralis major is a thick fan-shaped muscle situated at the chest of the body. The bicep is a large muscle that lies on the front of the upper arm between the shoulder and the elbow. Its main function is to flex and twist the forearm. The abdominal muscles support the trunk and allow the movement and hold the organs in place. The sartorius muscle is the longest muscle in the human body. It's a long, thin muscle that runs down the length of the thigh. This muscle helps you cross your legs. The abductor muscle group is located on the lateral side of the thigh and moves the thigh away from the body's midline. The trapezius muscle resembles a trapezoid or a diamond-shaped quadrilateral. It helps support the weight of the arm and move the shoulder. The deltoid forms the rounded, contoured shape of the human shoulder. It's a prime mover of the arm. The latissimus dorsi is the largest muscle in the upper body. It's responsible for the extension, abduction, and rotation of the shoulder. This muscle helps you do pull-ups at the gym. The serratus anterior is a muscle that originates on the surface of the 1st to the 8th ribs at the side of the chest. It acts to pull the scapula forward and around the thorax. The external oblique functions to pull the chest downward and compress the abdominal cavity. It also helps you perform side bending and rotating movements. The brachioradialis is a muscle of the forearm that flexes the forearm at the elbow, for example when you use a hammer. Finger extensions include 9 extensor muscles found on the posterior side of the forearm and extend the hand and the fingers. Finger flexors help you close your hand. Quadriceps is a large muscle group that includes 4 muscles on the front of the thigh. These muscles are the great extensor muscles of the knee. A hamstring is one of 3 thigh muscles in between the hip and the knee. The hamstrings cross and act upon 2 joints, the hip and the knee. The gastrocnemius forms half the calf muscle. Its function is flexing the foot at the ankle joint and flexing the leg at the knee joint. The tibialis anterior is responsible for flexing the foot backward and inverting the foot. The soleus is a powerful muscle at the back of the lower leg, aka the calf, and it runs from just below the knee to the heel. It's involved in standing and walking. The infraspinatus muscle is a thick triangular muscle, and it's one of the 4 muscles of the rotator cuff. Its function is to rotate the humerus and stabilize the shoulder. The teres major helps rotate the humerus and assists the latissimus dorsi in drawing the previous raised humerus downwards and backwards. The tricep is a large muscle on the back of the upper arm and is responsible for straightening the arm. The gluteus medius is a muscle that helps with hip movement. When you walk and run, it aids in stabilizing the pelvis, in particular when you perform activities where you're balancing on a single leg. And the glutamus maximus is the main extensor muscle of the hip. You see the glutamus maximus at work when you stand up from a chair, run, or go up steps.
This concludes the material for Lesson 9. Thank you guys for watching. Don't forget to do the reading. Check the description for more videos related to these topics and leave your questions for me in the comments below.